Well, hello, I'm Doug Apple, back with another special interview for you today. And we're going to start by talking about Venus Williams. She's the superstar tennis player, of course, now in her mid-40s, but making a comeback. In fact, just here on July 22nd, she became the first tennis match winner in a long time in her mid-40s. She won at the DC Open, becoming the second oldest woman to win one of these official matches at 45 years old, and she's going to continue playing. The interesting thing, though, is the reason she says she came back to tennis. Here's the headline in Newsweek. It reads thus: Venus Williams reveals she returned to tennis over health insurance. All right, we're going to talk to Mike Sharman of Share Healthcare about Venus Williams and her situation. And then we're going to talk about this thing of facility fees. If you look closely at your health bills, you might see some facility fees. And in some places, they're growing. We're going to talk about that in a little bit. But back to Venus Williams. Mike Sharman, before we get to you, here's one paragraph I want to read from the Newsweek article. It says this, quote, Williams' confession sheds light on the brutal reality of healthcare costs in America at present. If a professional athlete and a celebrity with a multi-million-dollar net worth says she needs to continue playing her sport to secure access to health coverage, even if it may have been somewhat tongue-in-cheek, it begs the question of how those without such hefty assets can possibly afford to pay their medical bills. Well, that's the question Newsweek is asking, and that's the question I'm going to come to you with, Mike Sharman. Talk a little bit about the Venus Williams situation and the ramifications and how we should all look at this.
Well, what she was talking about when she said they informed me this year that I'm on COBRA, so it's like I got to get my benefits on. Well, what's COBRA? COBRA is a federal law that says that if you lose your employer-provided insurance, then you have to be able to continue on that insurer for a certain amount of time, typically a year or so, but you pay what they say you should pay, which is literally thousands and thousands of dollars more per month than you would have been paying or your employer would have been paying.
Wow.
So it really, you take a huge hit when you're on COBRA. And so that transition from employed to unemployed is a real problem for a lot of people. Typically not a person who has a $95 million bank account, which is what Venus Williams is supposedly worth. But those issues prompt a lot of the spotlight, let's say, on healthcare sharing ministries like Share Healthcare. When somebody loses their job or loses their employer-provided insurance, they're going to be on COBRA, or what else are they going to do? Well, when people have stepped away from their job or lost their job, that's when a lot of people do come to Share Healthcare because we're very affordable and we share. It's not a contract. So it's $149 per month for a single, $249 for a couple, $349 for a family of four. So a whole lot different than thousands of dollars a month for COBRA. And what's the other big difference is that in insurance, you have that contract. You pay a X amount, we'll pay for your care, which Venus Williams had said she goes to her doctor a whole lot for the various injuries she's had over a lifetime of playing tennis. She said, I really need the insurance. Okay, but she could afford it. She could afford to pay out of pocket. It would not be a financial burden to her to actually pay it. But she's making a pragmatic cost-benefit analysis of, well, I like tennis, I'm good at tennis, I might as well come back, and by the way, I get my health insurance back so I don't have to pay for my doctor's bills. That's logical, that's a contract. With Share Healthcare, we have a covenant with our members, and that covenant is we're brothers and sisters in Christ, and we are responsible for one another. I mean, there's so many one another verses in the Bible that tell us that. And because of that responsibility, many of the members of Share Healthcare, even though they have a bill that might be technically shareable, they don't. They just keep it to themselves because they can pay for it. It's not a burden to them. That's a huge difference, that contract versus covenant one, and that mentality of if I can handle something myself, I will. And if it is a financial burden to me, then my brothers and sisters in Christ are told by God to help with that. We are to share one another's burdens. In fact, the verse for the verse model, let's say, for share healthcare is Hebrews 13:16. But do not forget to do good and to share, for with such sacrifices God is well pleased. Well, Venus Williams, like so many other folks, is just making a very rational economic decision. Well, if I can get a job that pays my health insurance, then I don't have to pay those bills myself, even though I could.
Mm-hmm.
It also points out, as the article mentioned, that part that you read, the cost of medical care is brutal, and the cost of health insurance itself is brutal. That COBRA, or if you're having to pay the insurance yourself, or if your boss is, because the average cost across America for employer-provided insurance for a family of four is $2,600 a month. And, the employer pays some of that, you pay some of that, but overall that's a burden on that business and that employee of $2,600 a month. And Venus just simply didn't want to pay the doctor, and she didn't want to pay the insurance, so she went back to tennis, and more power to her. That girl that she beat in that tournament that you mentioned was 22 years younger than she was.
Yes, well, I like that attitude of I can just go out and work some more and earn it.
Right, and we can just tell by her record, et cetera, that Venus Williams has been working hard ever since she was a teenager and probably younger. I don't know how her early training was, but she's had hard work this whole time. I mean, I'm a capitalist, so I think she earned that $95 million. She gave a whole lot of people joy just watching her play. So, like I said, more power to her.
Yes. So we talked a little bit about the Venus Williams situation, and I mentioned at the top of the interview here that we were going to get into this idea of facility fees. I see that NBC News is actually doing an expose on what they call surprise facility fees. Well, in fact, a little side note here. I heard a story the other day that somebody went to the doctor. They did an x-ray. They set the x-ray up there in the room with the patient, and then they have to wait for somebody to come in and read the x-ray and discuss it with them. Well, they took a picture of it, uploaded it to AI, got their diagnosis. And the doctor came in and they said, I don't need to pay, anybody else to read this x-ray. I've already got what I need to know. Goodbye. I don't know if that's true or not, but... Well,
it could be true, but it probably is really dangerous too.
Yeah,
it's kind of like people going to Google Law School to get some advice about what to do.
Yes. Well, I read about surprise fees, and I often think when my kids were little, and then we didn't have any insurance at all, so everything was just made on payments, but then we'd always get the surprise, to me, the radiologist fee. Mm-hmm. And I think, a few weeks later after some incident that's long forgotten now, and then here comes this $200 bill or whatever it was way back in the day. And those surprise fees, those are aggravating, and they sneak up on you. So NBC News is doing this thing on facility fees. What are those, and what do we need to be aware of, and what can we do about them?
Well, to make it easy for somebody to understand, I'm a lawyer, and besides representing Share Healthcare and being their general counsel, I have a law practice. So I send people out a bill, and the elements in our bill are, my hourly rate, how many hours I worked, and we list it all out line by line, what I did this day, what I did the next, what I did this 10-minute section, et cetera. And we also bill for my secretary, and we bill at a much lower rate for that, but they see what that hourly rate is, they see what she did. We bill for copies. If I have to travel somewhere, we bill for mileage. So we have those things. But imagine if I put on a bill, office rent, for the time that you were here for an appointment. That's a facility fee. Mm-hmm. It's even though people are paying me for my hourly rate and my secretaries and the copy and the mileage, And the people would rightly assume, well, you must have built into those fees your cost of operation. Yeah, we did. So why do I see rent of office for my appointment on here? Well, because I wanted more money. That's it in a nutshell about facility fees. And by the way, we don't put rent for the office on our bills. But that is what's happening with hospitals and clinics. The articles that you've mentioned about the Cleveland Clinic's use of the facility fee is not just at their hospital, but it's at the many clinics they have. All of them, whatever. Cleveland Clinic has lots of different permutations, whether it's a full set hospital or just basically a doc in a box, and they're putting a referral fee or a facility fee rather on each one of them. And the only reason is it makes them more money. The same thing, think of airlines. Airlines will charge you to choose your seat. Well, why do they do that? It doesn't change the number of seats. For all the era of flight up until somebody said, hey, let's charge them for choosing what seat they sit in, even though they might be, you choose your first class, you choose your business class, you choose your economy class, whatever you choose, it's going to cost you. Well, why? Well, so they can make more money beyond the price of a ticket. Let's use a technical term to describe this. It's just rude. Charging a facility fee when they've put a price on in their charge for their health care that takes into account the cost of operations. Mm-hmm. It's just a different way to up their pricing. It brings in a larger question or larger issue of what other expenses are there in a hospital or clinic fee that you might be able to spot that you really shouldn't have. Some hospitals will charge you for surgical kits, gloves, the medication delivery, not just the medication, but the medication delivery. They'll have the facility fees. They might have a specialist come in that you didn't necessarily ask for. We had a extended family member whose child was in the hospital for a very long time, and they were racking up a lot of bills. And they had reviewed the bills. The mom was an accountant, so she reviewed the bills. And having done that for a number of months, when somebody approached her door, the door of the hospital room, she asked them, "Well, what are you here for?" And they said, "Oh, I'm a nutritionist." And she said, "Okay, well, I know about nutrition. I know what she's getting. And let me just ask you, if you step through that door, will that automatically generate a fee?" And she said, "Yes." And she said, the mom said, "Well, and I think that fee is about $495 for you to step in and ask about how's the meals." She said, "Yes." She said, "Then don't step through the door. We're good." And so those specialist referrals, and if you're in a hospital, you're going to get a lot of them. And you may not need many of them. You may not need the social work referral. You may not need the psychology referral, et cetera. You may not need the nutritionist to stop by. You might need each one of those, but you should be able to know ahead of time, is this it or is this not? Mm-hmm. Then the markups in the hospital, the medication expenses in the hospital are at least 3 to 5 times higher than if you sent a friend out, "Hey, here's the prescription the doc gave me. I'm stuck here in the hospital. You go to the pharmacist and get my prescription for me." It's going to be, 20% less, let's say, than it would be what you get in the hospital. Well, why is that? Well, they want to make more money. The lab and imaging fees, boy, can you really lose some money there? And there's a huge range of prices on imaging. The ambulance and ER charges, particularly if you have flight ambulance. There's an enormous difference between a helicopter picking you up, an ambulance picking you up, or a friend driving you to the hospital. We've had bills of $45,000 for a 45-mile trip. I argued with a hospital one time when they told the mom the child had to be taken by air ambulance by helicopter from the hospital in one place to another hospital 45 miles away. And she said, well, he's not bleeding, not in problem. Why can't I just drive him? Oh, no, it needs to be an ambulance. He needs to get there quickly. Well, they wait 2 hours for the helicopter to do this 45-mile trip, which was $32,000 on that one. Well, obviously, there was no need for it. It was bad, and if they actually wanted to get the child there quicker, they should have let the mom drive.
And part of the thing there is that you're in an emergency situation, and you're trying to trust the professionals.
Yes. I had another one where it was an ambulance ride. The person called me as they're trying to put him on the gurney. And he called up and he said, I'm telling these folks I don't want to get in the hospital in an ambulance because I know how much it's going to cost, and I don't need an ambulance. Can you talk to them? And I said, just tell them you're on the phone with your attorney and it'll go away. But those are the type concerns that you might face. Now, pulling back again to share healthcare, those are the type things that we do for folks. We look over the bills. We reprice the bills. Sometimes folks will pay ahead of time. People who are members of Share Healthcare will want to be helpful, and they'll pay their bill, maybe a hospital bill, maybe as much as $14,000, $15,000. They'll pay it ahead of time and then submit the bill to us for sharing reimbursement. Bad idea. Why is that a bad idea? Because that $14,000 or $15,000 bill typically should really only be about a $4,000 to $6,000 bill. And that is that's the type of reduction we'll get day in and day out, because there's this ridiculous game that the hospitals play of, well, let's really inflate the price so that when people negotiate it down, insurers negotiate it down, whatever, then we get to the price that it really is. And that's what President Trump in his first administration tried to do with bill transparency. He tried to make sure that there is a price that everybody knows, and that's the average price that is actually paid by all insurers, et cetera, because that then tells you what the real price is. And that's what we need. I mean, don't you prefer it when you go onto a car lot where they have the price of the car, and that really is the price of the car, and they have it marked, as opposed to when you go on a car lot and you say, well, how much is this? Well, let's go in and talk to my sales manager, and we'll talk it over. No, that's an automatic walk away. But that's what we have with hospitals. Let's see what type of healthcare provision you have, and then we'll tell you how much it's going to cost.
With a car, you feel like you can walk away and just go somewhere else, but at the hospital, especially in an emergency situation, and then you are trying to trust them that they know what they're talking about. You might know a thing about buying a car or, about vehicles in general, but you come in and something has happened and now they're telling you they need to life flight you somewhere. Man, that's hard to argue with.
It is, but when I've had hospital administrators on the stand, or we've just asked them in discovery, does anyone other than self-pay patients that you sue, does anyone pay your retail price? And the answer is no. And the only reason the self-pay patients who they sue pay the retail is because the hospital will just submit the bill as part of their filing against them. And then that's what the court orders. But nobody pays that. I've gotten hospitals to drop cases when just by my asking them in discovery, what would Anthem pay on this? What would Blue Cross pay on this? What would on and on and on? I just said a list of insurers, and they don't want to tell you how much all those different ones will pay. And so rather than that, they'll dismiss a case that's hundreds of thousands of dollars. But again, from Share Healthcare's standpoint, we just regularly reprice the bills, and it's not a problem. We don't get kickback from the provider or the hospital. We know what their typical charge is going to be. If there is something that's mistaken on there, we will try to spot that and so have that taken off. But typically, we are able to know what that price is going to be in that zip code, and we send them a check for that. And by price, I don't mean the retail price. I mean the price that has been regularly set and paid. Mm-hmm. And so that winds up being, 40 to 60% of the retail bill, which, getting back to our monthly amount that we share, that's why we're $149 for a single, $249 for a couple, and $349 for a family of four. That repricing is one reason. The fact that our members will keep the bills that don't burden them. They'll send in, it's perfectly fine if they send in the bills that all fit within our handbook, amounts, et cetera. But they often won't, because they know they're part of this covenantal group and they don't have to send in everything. So that's another reason. Mm-hmm. Another big reason is we're not a bureaucracy. We're a 501c3 ministry, a nonprofit. And oh, by the way, the Cleveland Clinic that you mentioned that charges that facility fee, it's a nonprofit, but you would never know it. And we are not insurance, so we don't have all those regulatory costs. We don't have to, since we're not insurance, we don't have to share in those unbiblical things that insurance regulators and the Affordable Care Act, the federal government, says you have to share or you have to pay for. We don't have to because we're not insurance. So we don't have to pay for abortions, abortifacients, the transgender stuff, all those type of things.
Well, if people want more information, what should they do?
Well, they can either right away call 1-844-SHARE-HC, 1-844-SHARE-HC, or they can first go to our website, sharehealthcare.com, sharehealthcare.com, and rummage around that website, look it up, write down your questions, and then call 1-844-SHARE-HC. But if you call after hours, you're probably just going to get a recording because our workers go home to their families.
All right. Well, 1-844-SHARE-HC during regular business hours or anytime, sharehealthcare.com. That's Mr. Mike Sharman. And for Wave 94, I'm Doug Apple.